Hello, my name is Natalia Romero, working as an assistant professor here at the Faculty of Industrial Design in TU Delft. My expertise lies on designing healthcare technologies, and this is why I'm giving you a module on e-health. Let me start with a story. An old friend of mine experiences heavy episodes of migraine. Despite all the advances in medicine, the causes of his migraines are difficult to identify. Studies show relation to food, to sleep, to atmospheric pressure, hormones balance, stress, and a limitless list of other possibilities. Considering that the largest population affected by migraines is between 30 and 60 years old, the way these factors influence migraine are very subjective. Yet, my friend, like most other patients, will receive one of the top 10 treatments for migraine, prescription drugs for pain reliefs and for prevention. The question is, how could my friend understand the factors that influence his migraine episodes? How could he benefit from that understanding? How could his general practitioner, neurologist, dietitian, psychologist, endocrinologist, and even the weatherman come together to diagnose my friend's migraine and suggest the appropriate treatment and prevention plan for him? The emerging domain of e-health aims to provide answers to these questions. Although many would advocate that giving a definition to e-health is like trying to define the internet, which is highly dependent on the dynamic way that has been used. A definition that receives general acceptance is: e-health is the intersection between medical informatics, public health, and technology. Its success implies a shift in the way health has been understood so far by the health and public sector, by considering improvements in healthcare at different levels through information and communication technologies. E-health originates from the emergence of Web 2.0, which transforms the internet into a two-way exchange of information. Telemedicine, the possibility to communicate remotely and even asynchronous with one's physician, became an opportunity to make care an efficient process and therefore to optimize the increasing public health demands and the limited medical resources. Later came the rise of social networks, which made possible to consider exchange of information beyond one's physician, to, for example, among peers. Nowadays, we can observe that at least two predominant directions in which e-health is developing. First, self-management care. Mobile technologies, for example, smartphones, sensor networks, IoT frameworks, become ubiquitous in people's daily life. And with that, data around people's activities and experiences becomes an asset to transform care as a self-management process. The role of data becomes key in empowering and engaging people to gather, interpret, reflect, and act upon relevant data to maintain or improve their health condition. Second one is smart care. Big data and artificial intelligence, for example, data mining and deep learning, are becoming powerful tools to personalize treatments, increase patients' knowledge with efficient delivery of information, as well as to prevent and predict diseases. The primary aim is to innovate in health and health systems performance in order to provide smart care. The possibility to apply big data and artificial intelligence techniques for the analysis of health and disease records, latest medical research advances, demographics, and even interviews of other subjective inputs from a large population, it will provide opportunities to map one health condition in a holistic and dynamic fashion where many factors will interact to provide knowledge for prediction and even prevention of the development of diseases at an individual level. One of the biggest worldwide challenges that nations are facing is an increased demand for care and quality of care. One of the main reasons is due to population growth, specifically to the growing number of aging groups. In addition, nations face every year an increased number of people that are affected by chronic diseases. Only in America, 50% of the population has at least one chronic medical condition, and this number is projected to increase by more than 1% per year by 2030, moving from 133 million to 171 million of people affected by at least one chronic medical condition. Another problem is the rising number of new and complex diseases and epidemics. Therefore, governments are expected to offer health systems that are efficient in researching and implementing innovative solutions and effective in improving the quality of care to the entire population, in a context where resources such as care institutions and professionals are scarce. E-health comes as an opportunity to address these societal and economical problems. First, by implementing personalized preventive care in order to divert the need for hospitalization. Second, by enabling recovery care at home in order to implement early discharge after surgery. Third, by supporting home care of chronic diseases at home, integrating professional and non-professional caregivers, examples, spouse and adult children, in order to minimize long stays at the hospital and increase the quality of life as an independent citizen. The success of e-health solutions lies on the long-term adoption of e-health technologies in people's life, enabling them to adopt and/or adapt a healthier behavior. To achieve this sustained impact, designers need to work under two premises. First, adopting a user-centered design approach for the developing of engaging technologies. Second, involving a multidisciplinary team of players and stakeholders for the development of feasible and viable solutions.